The National Assembly's Committee on Health has given Mediheal Group of Hospitals a clean bill of health of allegations of suspicious NHIF billings. As NTV's Gabriel Kudaka now reports, the hospital's troubles started last year after several government entities withdrew insurance services covering civil servants, among them police officers and teachers. NHIF owes the Eldoret branch some 51 million shillings.
The fact-finding mission by the Departmental Committee on Health to investigate health facilities that are suspected of colluding with rogue officials to embezzle public funds from the NHIF led the team to Mediheal Group of Hospitals headquarters in Eldoret.
This investigation started last year, and it began after media expose by the nation, in which certain hospitals were listed as engaging in fraudulent activities.
And after a lengthy investigation that took them on a tour of the hospital's various departments, perusing through the books, the team finally gave its verdict.
We sympathize with their situation because from the records what we've seen, we did not note any discrepancy in as far as their claims are concerned.
And the management of the ailing hospital seized the opportunity to shed light on the genesis of their troubles that began after last year's general election that have nearly crippled its operations.
A Mediheal Group of insurance companies, which was a very big insurance client for us, they stopped Mediheal from being their client service provider. Then in the 2023 January, even the police, NHIF police was withdrawn from Mediheal Hospital. That hit us more. It further reduced the revenue by more than 25 to 30%. So all in all, we had a revenue loss of 60% in the period of 3 months.
By December 2023, the once vibrant hospital with the state-of-the-art equipment was literally fighting for its life after halting its inpatient services.
So we had taken major loans. I think you understand, you must have seen the machineries we have. We had taken very, very big loans from the hospital, from the banks to sustain the growth of the project. And if you see, we had lot of good employee to patient, the nurse to patient ratio was very high. Even the number of technicians working in the lab was very high.
The patients would soon flee the hospital due to dwindling quality of services occasioned by inadequate staff, among other challenges caused by financial constraints.
We were having challenges in paying back to our vendors because we didn't have money to pay back to the medicines and all, so the medical supplies were cut off. Then the regular insurance companies, because the patients were not getting medicines in time, they started reducing, so outpatient kept on reducing. So what we used to get about, let's say for an example, in Eldoret we were having almost 500 outpatients per day. It reduced to almost less than 200 per day. Right now we are having almost about 50 to 60.
The facility that began in 2004 has more than 5 branches across the country, majority of which risk closure after more than 2,500 employees were rendered jobless. Gabriel Kudaka, NTV.